we are talking all about nursing arm, nursing shoulder, the pain and discomfort that you are getting in the shoulder or elbow or even your mid-back from holding babe and nursing. So new moms especially might be feeling these aches and pains. To start, we're going to go over what the in-office treatment looks like. We always start with soft tissue before we do adjusting, but I'm simply helping stretch that pectoralis muscle. The upper portion specifically helps us internally rotate our elbow and our arm when we're holding babe, so it's not uncommon that this gets pretty tight and tender. And then same motion, she's going from hip to diagonal corner. She's going to actively move her arm as I am pinning and stretching that pec muscle. Good job. Nice. We usually say 3 to 4 reps, just kind of depending on their tightness and how it responds. Awesome. And now we're just checking mobility. Very good. And the adjustment is just a gentle drop piece. So that's the noise you're hearing. If you're someone that's also experiencing some neck discomfort from nursing, or like I mentioned before, that mid-back, upper back discomfort, we're also going to do some adjusting in those areas to help open the joints up and relax some of those muscle tissues. So for things you can do at home to help combat this pain you're getting, usually in the front of the shoulder, we are talking different ways that you can hold baby while we are nursing. So to start, most people are in this typical position with babe's head always in this arm. What I'm going to suggest is just simply using a boppy. Take the weight off of baby so then they both can rest and pillow your arm and babe rather than holding it up. You can also use the boppy in a cross cradle position. So babe is simply here and boppy is still helping support. If you want to lay down, get yourself a wedge pillow. You might have one from your pregnancy. Scoot back, lean back. You have this head to support. You can always add a pillow if you'd like, but then you aren't looking or holding your neck looking down. It's simply resting on a pillow. And you're nice and elevated so it can take some relief off any low back pain you might be having too. As far as stretches go, we're going to first stretch these front muscles and we're also going to activate the back side. To stretch, find yourself a wall or a doorway, make an L with your elbow and simply step forward. You should feel a really nice stretch through this front chest area. You can even add rotation looking away from that wall. And of course, do both sides. For the activation piece, simply start with your hands overhead. You could use a wall here for a good cue, but just in the air is fine too. And you're simply gonna lift away and then rest back and then lift towards the back of the room and rest. It's gonna activate your lower trapezius muscles, helping combat any of the forward hunching that you might be doing all the time. Second one is a simple row. Having your arms here, you simply squeeze those shoulder blades back and together and then bring them forward. Squeeze them back and bring them forward. There's always an option to do a row bent over, but if you're already experiencing pain in these areas, it's good to start simple before we progress to something more advanced. If you have any questions, please let us know.